Thank you for joining in today for this episode of The Advocate, a production of the American Society for Gastrointestinal Endoscopy that informs physicians and patients on emerging healthcare topics impacting GI. ASG represents over 14,000 gastroenterologists worldwide and is the leading voice for GI endoscopy.
Hello, everybody, and welcome to ASGE, The Advocate. I'm your host today. My name is Dr. Luke John Day. I currently serve as the chair of the ASGE Quality Committee. I'm also a professor of medicine at the University of California, San Francisco, and also the chief medical officer at our county hospital, the Zuckerberg San Francisco General Hospital. In June, we celebrate Pride. Pride has a long tradition, initially commemorating the Stonewall riots of June 1969. Every year, Pride events are held worldwide to recognize the impact of the LGBTQ community and people have had in this world, and also to celebrate and embrace identities of all kinds. In recognition of Pride Month, today's episode is going to address the LGBTQ community in medicine from both the GI professional and patient perspectives. I'm pleased to have with me today 3 GI physicians that are members of the LGBTQ community. First, we have Dr. Dana Early, who is a professor of medicine at the Washington University School of Medicine in St. Louis, Missouri. Dr. Early has nearly 30 years of experience in the field of gastroenterology. Second, we have Dr. Mallory Simons, recently who completed her GI fellowship at Johns Hopkins University and will be starting her advanced endoscopy fellowship at Weill Cornell in New York City. And finally, we have Dr. Austin Chang, who is an assistant professor of medicine at Jefferson Health in Philadelphia, Pennsylvania. Dr. Chang also serves as the chair of ASGE's social media task force. Thank you to all of our panelists for participating in tonight's conversation. Let's get started. The first question we have will really talk about patients' perspectives, especially as it relates to the LGBTQ community. First, do you believe the medical community is being more informed about the care considerations for members of the LGBTQ community? For example, what strides do you think have been made? And are there areas in gastroenterology where there are significant gaps?
Yeah, I think it's an incredibly important question to ask specifically during these times. And I think the role of gastroenterology in general can play a very key part in this, because many people feel very embarrassed to talk to their GI doctor. You know, we'll have patients that say, I'm gonna go see the butt doctor, or you're gonna look down there for my procedure. And I think we are in a position where we can really interact with patients when they're feeling the most vulnerable. And so I think we're in a very wonderful position where we can help a lot of patients. And it's even more important for us to be very transparent and open so that everybody can feel comfortable speaking with us. I think in regards to patients specifically, I think the transparency has definitely improved. I mean, just with the electronic medical records, now we're really starting to see they're flagging patients to make sure that we, say their name correctly. They put it in quotation marks. They'll say preferred pronouns to make sure they say this name correctly and this gender correctly with these pronouns to avoid really making people feel uncomfortable. And specifically, I think dead naming can be very important. And for those of you who didn't know, that was kind of new to me, is that really referring to someone who has transitioned from one gender to another one is to call them by the name that they preferred and not necessarily by their birth name, because that can be actually pretty hurtful and scarring to them. And so I think that that's one aspect. And then I think the second aspect is just showing openness as a GI community. I mean, I have one of my mentors is Ellen Stein. She's a motility physician, and she wears a rainbow lanyard. And I was with her, and one of her patients said, "But you're not gay. Why are you wearing that?" And she's like, "I support everybody. I don't have to be gay to support somebody." And I thought that was a very powerful moment for both the patient and actually for me as a mentee. And so I think, there was one of my program directors at Brown when I did my residency there, Dr. Dominic Tamaro, he had a pin that said straight but not narrow. And so there's the sense of that openness in regards to to being open to any type of patient diversity is what's really changed. And that's really been very cool to see over the past few years.
Thank you, Dr. Simons. I especially love the two words that you use, which is transparency and openness. I think that definitely sets the stage, especially in that initial encounter you have with patients. It sort of, starts a nice dialogue. It shows them to be comfortable, vulnerable. So I really love that approach, and I love sort of, your thoughts about it. Thank you very much for sharing that. Dr. Chang, how about you? What are your thoughts to the question?
I loved what Dr. Simon said about, seizing the opportunity, in our field specifically, to talk to patients about some of these more sensitive subjects. And I think that in terms of kind of trying to gauge what the strides have been in terms of, how much progress we've made, it's hard to discern what's actually a result of kind of societal change as a whole versus, just specific to the medical community. But I do think that there has been significant strides that have been made. And in terms of GI specifically, I also think it's difficult for me to figure out, how much progress has been made in some ways, just because it's very institution dependent. And I can imagine that, depending on where you practice and who you come across and the approach that your institution has towards towards Pride Month and LGBTQ individuals, I think it's, it may differ a lot. But, I'm very fortunate to be working at a place where, kind of like what Dr. Simon says, there's people who are, out and open, also, allies who are also proudly wearing, pride type of, symbolism. And so I think it's really important to have colleagues like that. But I also want to say that, within GI, in terms of how we treat our patients, there's a lot more that we need to understand, and perhaps more directed research towards, the needs of LGBTQ patients. So hopefully we'll see more progress in the years to come.
100% agree with you that we've made a lot of progress, but there still is definitely much more work ahead of us that needs to be done. And then Dr. Early, what are your thoughts on this question?
So I've been at this a lot longer than the other two panelists. And so I think I've seen change much more gradually, but, from something as simple as, acknowledging, a family member as actually being a family member, that patients feel comfortable introducing their partner as their partner or their wife or their husband when, years ago, I don't think patients were comfortable doing that. They would say, this is my friend or this is my roommate. And there's sort of, some shared decision-making and information sharing that goes along with somebody who's a spouse or, a significant other that doesn't necessarily equate with that of, say, a friendship. And so those are important, I think, distinctions to make. And I think, we all know in the settings that we encounter patients, a lot of times they feel very vulnerable and scared. And I think knowing that their significant other is involved in, meeting the physician and hearing what the physician has to say, and that the physician is speaking to them as well, I think has really been very helpful and has, I would say, become mostly commonplace. I practice in a metropolitan area in St. Louis that's, much more accepting of alternative lifestyles than other areas, although, we have patients come from rural areas as well. And so it's a bit of it's a diverse group. Our Department of Medicine chair, Vicki Frazier, is very in tune to the special sort of needs and expectations, I guess, of the LGBTQ community. She's been a real champion for those efforts. It doesn't necessarily, trickle down everywhere in the medical center, I've noticed, but it's certainly, I think leadership plays a big part in changing how we view things. I think we have a lot of progress we could still make in making the, the transgender patient feel more comfortable discussing their transition, or even just acknowledging that they, are the gender that they feel like they are, And, even, staff still sort of stumble over, should we call the person this or that? And, they're afraid to ask. And I think we could really make a lot more progress in terms of making transgender patients feel more comfortable and making their significant others feel more comfortable, in medical settings.
Well, thank you, all of you, for those wonderful answers around sort of, our patients' experience, especially those in the LGBT community. What I'm hearing is progress has been made and quite a bit, but there's still a lot of work ahead, especially I think in terms of educating our staff and the institutions we work at. And again, I go back to what Dr. Simon said at the beginning. It's that transparency and that openness and that acknowledgement when we first meet our patients, really trying to create that welcoming environment. We're now going to transition to the experiences of our panelists as LGBTQ members of the community, and really sort of their thoughts about healthcare providers. And so the question that I have, and we'll start with Dr. Chang next, is a recent study that was published in JAMA found that burnout among LGBTQ medical students was about 8 times higher than their heterosexual counterparts. This was attributed to several things, but a large factor that was demonstrated in this study was treatment by other members in the healthcare field. And the question to all of our panelists is going to be, did you find this true of your experience during your medical training, anywhere from medical school on through fellowship and even as healthcare providers now? And what do you think we should be doing about it to improve this moving forward?
Well, I think, speaking from my own experience, I certainly did not face, I don't feel like I personally, I only know my own experience, but I don't feel like I've experienced more frustration or burnout than others. And I feel that, that word burnout is, sometimes I'm not sure whether or not, what I'm experiencing or what I'm seeing in others is necessarily burnout. But I'd say that, I don't tend to hear it from my colleagues as much either, but at the same time, it makes me wonder whether or not it's just not being detected, and if people are staying silent about it. But I think, again, I've trained at places that are located in big metropolitan areas, politically liberal areas. And so, I think that there's been greater acceptance, and the LGBTQ individuals and trainees feel much more a part of the community, especially with many individuals represented in these classes. So it's hard for me to say whether or not there is truly like a difference there. But I think that moving forward, just keeping an open dialogue, and again, that word transparency comes to mind, is probably, the best approach.
Thank you. Dr. Early, what are your thoughts on this question as it pertains to burnout among LGBTQ healthcare providers?
Yeah, that's a good question. I didn't realize that was a finding in the study until you had mentioned that. And I think back to 1995 when I finished my GI training, and I think it's still done now. There was a party for the trainees and their spouses or significant others at the program director's house. And I actually brought my wife. She wasn't my wife at the time, but we were in a long-term relationship. And, she was well accepted. It was a wonderful evening. But I remember one of my co-fellows calling me a few days later and saying, wow, my husband and I thought that was really brave of you to bring her to the dinner. And I thought, wow, brave. Maybe it was, I don't know. But I think if that happened, we have a fellow graduation party next week. And if that happened next week, it wouldn't even be a topic of discussion. I mean, no one would even think twice about it. So I think there's been, significant strides. I think, when I was a trainee, there was still a lot of behavior that you could probably label as hazing and bullying. And, ours was not the environment where we had the ACGME or a residency director that really seemed to sort of care. whether we were subject to those kind of behaviors. And so we, you learn not to complain about anything, and you learn kind of not to draw attention to yourself. And being, an out lesbian is certainly a way to draw attention to yourself. So I didn't do that for a very long time. But I think in the environment I'm in right now, it's very well accepted. It's just not considered, we're just another family, just like all the other families, physicians and their spouses. But I think it's been a long time getting to that. Honestly, even as a young attending, I wasn't comfortable, sharing those kind of details with my colleagues. It wasn't until my wife had a baby, and so I had a car seat in the back of my car, an infant car seat, and all the doctors at the hospital I worked at, we all parked in the same parking lot. And so everyone knew that all of a sudden, Dana Early had a car seat in the back of her car. And I think that was the turning point for me, is like, if I was going to have children, I wasn't going to hide anything about our family or our relationship. And so I think it just for me personally became much easier at that point. But and maybe I sold my colleagues short, and they would have been much more accepting than I anticipated. But there's definitely sort of a fear of, bullying or deferential treatment, when I was a trainee. And I feel like has really changed over the years.
Thank you so much for sharing that experience. Dr. Simons.
I think, thanks for asking, this question. I think, Dr. Early, you should know that with all of your years experience, you and Dr. Chang as well, but you're not too much older than I am, but Dr. Early, you really paved the way for a lot of us. And so even though what you thought at that point might not have been brave, it certainly is brave to me and to my colleagues who are just, able to live life more freely, even at a point than you have. So thank you for that. I think when I first I read that study, and I really do commend the authors for at least, for looking into this, because there really aren't a lot of data right now on LGBTQ and burnout specifically. And I agree with Dr. Chang, burnout is definitely multifactorial. And I think the authors did a great job that said, just because someone is LGBTQ, that doesn't equal higher likelihood of burnout. There's maybe a correlation, but there's a lot that goes into burnout, and it's a complicated issue that we all, as a medical society, LGBTQ or not, we need to definitely address. I think what was also really interesting about that specific study is they mentioned mistreatment, humiliation, and that was in both heteronormative and also in LGBTQ. I hope that one day, I just was shocked at how high both of those numbers in those groups were. I hope we can get both of those to be zero. So I think that I do appreciate the authors looking into LGBTQ specifically to show that, but I hope that it gets to be, we can get it to zero for all parties involved. And I do have to say that it is important to know that, you may probably know more than I do, especially Dr. Early, but, mental health is a concern in it's a higher risk in the LGBTQ communities of developing depression, anxiety, and substance abuse too. So I think that that's something is making sure that linking those for medical professionals that in this community to make sure that there's access to resources as well, like mental health resources. And I think that that's going to be, really important, that I thought the authors did a good job of acknowledging. I think from my personal experience, I personally have not had what they're calling mistreatment. I would have little, snide remarks maybe by saying, listen, in your interviews, don't mention anything about your personal life. You don't want them to hold anything against you. So the intention was very well-meaning, but true or not true, we shouldn't have to hide that. And so I think for me personally, I think which could relate to in the future if it didn't change to burnout, was specifically of my decision of where to go, and also specifically of how I would raise the family. And Dr. Early touched on this earlier. And I think we need to clarify, it has nothing to do with red and blue states. I think that, our Republican colleagues, this is not saying that, Republican means anti-gay, which I think there's a little bit of a connotation, which I hope that that's not perpetuate that. But I know, when in 2013, the Supreme Court said it's unconstitutional to prevent same-sex marriages, and I got married in 2014. Another big thing was in 2017, the Supreme Court made it unconstitutional that same-sex marriages cannot not be put on the birth certificate. And so my daughter was born in 2018, and I wasn't the birthing mother, but because that law was just passed, that I was then able to be on her birth certificate and didn't have to go through a lot of the headache, financial fees, and emotional headache of adopting, which was huge. And some states still give a little bit more, and some areas give a little bit more of a hard time for that. But I was fortunate that I didn't have to, by 1 year, I didn't have to struggle with that. And so I think that to me, those 2013 to 2014 is when I went to residency. And then 2017 to 2018 is when I went to fellowships. And so it was more stressful to me to figure out, okay, where am I going to live so that I could now raise a family without, having that headache and that stress, because that could be really personally draining. And I'm sure would have had mental health, considerations for me as well. And now I feel so very fortunate. I am going back to New York City, which I'm from New York, but my wife is pregnant with another girl. And so it's very fortunate to have that security and the legal aspect behind that protects us. And so I think, to me, I think we're making headways and we're making strides in supporting our LGBTQ, especially supporting their support system, which is their families. And so I feel fortunate that I didn't have that, mistreatment, but there are certainly others that have. And I think it's important that we acknowledge that and keep a close eye on.
First, congratulations, Dr. Simons.
Thank you.
And then again, really want to thank our panelists for sharing their personal experiences. Some of these in discussing them can be really challenging and difficult. And so I really appreciate everyone really coming to the table and sharing those stories. I, also had a similar experience as Dr. Simon said. I didn't go to medical school that long ago. It was in this century, but it was at the beginning of it. But I was told, both for medical school and for residency and fellowship, and this is in San Francisco, not to put or not to allude to anything in my personal life that would out me. And this is in the Bay Area. And, even though the Bay Area is very progressive, I think healthcare, has moved, in the right direction, but I think a little bit slower pace than some other areas within the workforce. I will say this though, the one thing that, I always have just tremendous hope on is all of the students that I see nowadays. They will not tolerate anything that comes across as bias or excluding anyone, and they will speak up about it, which is it's just really remarkable to see. And it's not that I think in years past we didn't want to do it, but I think it's now more of a collective of like, we will speak out to help support everyone else. And so I think it's advocacy for their patients, but also for their classmates. And so I think that is just, that has always just given me such promise and hope that things will only continue to get better. So thank you again, everyone, for sharing. Our final question, and it's a long one, so I apologize. And we will start with you, Dr. Early, on it. 74 countries prohibit discrimination in employment because of sexual orientation. However, in the United States, there is no federal law protecting employees from discrimination based on sexual orientation or gender identity. Despite progress being made to eradicate stigma, many LGBTQ professionals report having challenges in the workplace. Common workplace issues reported by LGBTQ professionals include uncertainty over coming out, as we've discussed today, speaking up against hetero or cisgender bias. What strides do you believe the healthcare field has taken to be more inclusive of our LGBTQ professionals? What do you believe can be done to make the healthcare work environment more inclusive as it relates to your team?
Well, no, that's a great question. It's somewhat complex. I guess I feel like because our medical profession involves taking care of patients, that hopefully we would draw the corollary between the way that we treat our patients and the way that we treat each other as colleagues. And so by that, I mean, I think it's an expectation, certainly at my medical center, it's an expectation that you treat patients with respect and you value everyone's diversity and you involve family members in decision making, when the patient chooses to, and there just is no room for any kind of bias or discrimination. And so I think, because we have that model in place for how we are expected to treat patients, that it would hopefully naturally flow then that's how we would treat, our colleagues. And, like I mentioned, at least, in our place, there's a very much of a top-down model that, diversity is not only, it's not tolerated. That's not a good word anymore. It's celebrated. Tolerating it is really more of a negative connotation these days, but that it's more celebrated from, our chancellor to our dean, to, like I said, our chair of medicine to my division chief. And I think it really takes individuals like that, not only acting that way and talking that way, but really, setting themselves out as examples of how, all relationships and all ways of life should be celebrated. So I think continuing to raise awareness, I think it really does. I always have kind of wondered in the past over time, does raising awareness really work? And I think, yes, it really works. And so any way that we can do that in small ways or in large ways, our department always has a group that walks in the Gay Pride parade, and our church does. And, we have a group in our Department of Medicine called OutMed. And so this identifies groups of internal medicine physicians that want to make themselves available to LGBTQ patients and say that it's okay if you come and see me, I'm going to treat you just like I would treat anyone else. And so I think initiatives like that and raising awareness in those ways, I think is the way forward.
Thank you very much for sharing that. Dr. Simons.
I think that's, I love that idea of raising awareness. I think that's incredibly important. I think to really improve and push forward this in regards to patient care and also professional care is representation is so important. And I think, and I think you mentioned this a little bit, Dr. Day, when you were talking as well, is that we are going to see a large sum of physicians, nurses who are very proud LGBTQ plus, especially nowadays. And I think I was reading a study that I think that the AAMC said that they only out of like graduating medical students from 2017 to 2019, they only reported around 4% were out. Which, I mean, just anecdotally, I feel like that was a very gross underestimation, but that's what people would say. And that's what the data that they had. And then now we get a report from Harvard in 2020 that, their incoming class of medical students is 15%. And that's probably even underestimating as well. Because of, maybe people wouldn't want to report it, they're not sure, or they didn't report either any answer. And so I think what we're seeing now is that there's going to be a very large sum of people who identify in the community and are going to be in healthcare. And so now we're seeing, with President Biden and, just even nominating Dr. Rachel Levine, that's giving representation and giving a voice and saying that, whatever, our differences should be celebrated, as Dr. Early was saying. But also what talent is going to be coming up in the field. And it's sad that, in decades beforehand, that this talent was, due to maybe non-acceptance, is that it wasn't seen. And so I think representation is so important in media and in the field, so that it can really reach out to the patient so that they know that I have doctors that are like me too. So I think that's one aspect. For representation. But then I think the second one, which is really important, is mentorship. And I know for me, in my stage right now, I don't particularly have an LGBTQ mentor. And I think a lot of it had to do with, the time of being more open, or just, but people weren't going into medicine identifying as, in our community. But I think now we're going to see a huge sum, as I was talking about before, and it's going to be so important they have mentors. And I hope whatever limited experience or knowledge I would have. And so I think representation, and then again, to really promote that, is going to be the mentorship, which is going to be so important, which I'm so thankful Dr. Chang and Dr. Early are on this panel today, because I'm more of a youngin', but you guys have definitely experienced more than I have. And so those are my two ways that I feel like that we can make a difference in our community, both on a professional and a patient standpoint.
Wonderful. Thank you very much. And Dr. Chang.
So yeah, I totally agree also with, increased visibility and awareness. I think that, even though I'd love to assume that we have, us entering the health profession kind of would adopt how we, how we're taught to take care of patients the same way we take care of each other. But I think that, there just needs to be more active kind of education. And I think that it should start at the medical school level. The times have changed. And so, medical education is probably different than when I went through med school, but I feel like this was not talked about when I was in medical school in any formal way. And I think that, that's not to necessarily point fingers at specific people, but I think that on the other hand, now that people are more open in, speaking about their own stories, organizing and coming together, I think is really important, because it kind of provides a collective voice and, a community for people to, within one's institution or one's specialty or field, to discuss some of these issues. Sometimes there's just no place to turn to. And so, even maybe within the ASGE and our professional societies, we can also do this as well. But hopefully, when you organize, there can actually be an impetus to change, for institutions. I totally agree with, the idea of representation. And I feel like part of what can facilitate representation is having, an organized group of people and, being able to speak out about certain issues, raise awareness, heighten that awareness within an institution to then potentially lead to change and, bring people within the LGBTQ community into leadership positions to actually facilitate that sort of representation. So in any case, I know that this is like a very, there are a myriad of ways to kind of approach this and improve upon the situation, but I'd say, just more education in general.
Thank you all again. A really rich discussion on the topic. Again, I 100% agree with representation and visibility, not only for our patients, but I think also for other members within the healthcare community. And, in this month celebrating Pride, I 100% agree with Dr. Early on that we have to celebrate diversity and not just during this month, but I think every day throughout the year. So I really appreciate that discussion on this topic. Our final question for the night is, health equity is a priority of the Biden administration. What would you say health equity looks like for the LGBTQ community? And Dr. Chang, why don't we start with you first?
Well, I think that, that's a really complex question, but I would say that it depends on if we're speaking, from a patient perspective or from a physician or health professional perspective. But either way, I think it's just ensuring that, everyone is given equal opportunities and is, given the same kind of treatment, and from a patient perspective, that also entails understanding like what their needs are. And I feel like, my personal perspective is that I don't know what I don't know. And so, hopefully looking into this further collectively as a field, we can help identify like what the needs are and where we're, where we're lacking, and so that we can kind of level the playing field in terms of those opportunities.
Thank you very much. Dr. Early.
Yeah, I think, health equity means, access to high quality health care for everyone. I'm not aware of any specific lesbian and gay health issues, I think, that aren't necessarily addressed, but I do think that having access to all the care they need for transgender individuals, particularly transgender youth, I think we could really improve access for those patients. I think the care, of transgender individuals as patients really it needs to be multidisciplinary. And, access to that kind of care is probably limited to large medical centers. But, I see that as a definite room for improvement, is to create the type of care that transgender individuals need as they transition, and make that accessible.
Thank you. Dr. Simons.
I agree that, Dr. Chang was really saying about education is crucial, and with Dr. Early saying accessibility, I think those are probably the most key that I couldn't have said it better myself. Maybe the third one I would add is I do think affordability and insurance as well, making sure that there's no discrimination between coverage regarding LGBTQ communities, because I do know that there are some patients that will have that concern as well, and rightfully so. And so I think just keeping an open mind and making sure that we do our part with educating them. We make sure that we communicate with insurance as well, so that make sure that the care is affordable as well as accessible. So I would say those are I agree.
Thank you all for that discussion on health equity and the LGBTQ community. We are drawing near the end of our wonderful discussion tonight. I guess the final question I have is really to get any final thoughts or takeaways from each of our panelists, especially as we're nearing the end of the month of June and the end of Pride, but any takeaways or final thoughts? And Dr. Simons, I'll turn it back to you.
Yeah. I love that question. Really make a positive make a positive end to this. I think it's great. I think my final thought is the beautiful part of the LGBTQ community is this sense of advocacy. And I think, I wasn't a part of the 1980s, when AIDS was just, really it was an epidemic. And the fact that the LGBTQ community, really joined forces to advocate, because at that point you're really being skewed as this is only a gay disease. Only gay men can get this. And then in the 1980s with the ACT UP program, there was a large amount of women that was like, wait a minute, hold on. We need to advocate for our brothers, and we need to advocate for them and just say, hey, wait a minute, this is not just a gay disease. We need to make sure that care we're educating appropriately, that it's not just men who have sex with men. This is not just a gay disease. This is a lot bigger than that. And it really was women, and also actually, I think from my reading, it really was a lot of lesbian women who are really a great advocate for the LGBTQ community, and to really improve the lives of patients that that had HIV or AIDS, and to advocate for research and prevention and treatment. And so the LGBTQ is I feel very proud to be a part of the community. This is the first time I've ever done an open interview. It's not that I'm not out, but this is the first time I've ever been way more open about it. But I'm really, really proud of what we have accomplished as an LGBTQ community, and our sense of advocacy and really helping one another. I see it really even doing great things in the future.
Thank you very much. Dr. Chang.
Well, first of all, thanks for having me here. I think that, it's a great step, first of all, to have this kind of conversation in the ASG. I don't know if we have had kind of an interview like this or something to kind of commemorate the occasion from our societal perspective. So I think this is a great start. If this is the first time, I'm not sure, but I think that there's a lot more that we can do as a society to kind of bring together, those of us within the LGBTQ community in this field. I think that I'd love to see the community grow and get to know each other and be a resource to one another in the future. But I also would like to say that, as individuals, we all exert a certain amount of influence on our communities. Obviously I'm very much into social media and, putting ourselves out there and, increasing that visibility. We all can play a part ourselves in doing that. And I think that it's important not to underestimate that.
Thank you very much. Dr. Early, you get the final word.
Okay. Well, those are all great comments, I have to say, and I agree with them wholeheartedly. I guess I'll just end by saying, like, bravo to the ASGE. When I got this email from Lakeisha, I thought, wow, this is amazing that they actually care about this. And there's a lot of people in the ASGE that I really care about and respect, but have never had this type of conversation with them. And, I think, within the field of gastroenterology, the ASG is one of the leaders. And I think, it's really wonderful that they made the effort to showcase these types of issues and bring this to their members. And I guess anyone else that wants to see. And that's the type of, leadership and, you can call it advocacy that I think we need to keep moving forward.
Unfortunately, we are out of time. I first really want to extend my sincere thanks, gratitude to Drs. Early, Simons, and Chang for addressing some incredibly important issues today. I'm just incredibly proud of all of you for having a very honest, frank, and just wonderful discussion today. I believe, as all of you have said today, that this is the first discussion I think that one of our GI societies has worked on, which I think is just one of many that is going to be happening in the future. And I think many of the things we discussed today, we're embodying, I think, in this discussion. Really, I think being visible, present, having our advocacy, but I think also just serving as mentors for people in the future. So I, again, am just really grateful and deeply impressed by all of you joining us here tonight. I'd like to finish by stating that ASGE recognizes and values the importance of embracing diversity, equity, and inclusion, and its impact on strengthening the profession, our organization, and our members' ability to provide excellent care to all of our patient populations. We welcome your feedback on this topic and others. And from everybody at the ASGE, thank you for watching. We will catch up very soon on our next edition of ASGE The Advocate. Thank you all very much, and I hope you have a great evening.